The retirement lie. Why Gen Z will pay for boomers' golden years. The deposit hits at 9:01 a.m. By 9:03, rent drafts. Health insurance pulls its cut. Groceries, student loans, gas. What's left looks fine until the payroll taxes settle. Social Security, Medicare, unemployment. Money you'll never see again, funding someone else's present. You're told it's your future too. Meanwhile, the clock ticks toward a year when checks get trimmed and the trust fund turns into IOUs redeemed with more taxes or more debt. Nobody asks your vote on that. We're going to follow the money, who pays when it breaks, and how it lands on your paycheck. The setup lie. Pay as you go, not savings. To understand the squeeze, we need to go back to the moment the promise was designed. Social Security wasn't built as a personal savings plan. It was built as a transfer system. Today's workers fund today's retirees. Your contributions don't go into an account with your name on it. They flow out immediately to someone already retired, with a promise that the next generation will do the same for you. In the early years, that model looked generous. There were many workers for each retiree. People retired later and didn't live as long after retirement. A single payroll tax rate could cover checks and still leave the system looking healthy. Early retirees received far more than they contributed because the system was young and the pipeline was wide. Politically, it was a winner. Steady checks for grandparents, small deductions for grandkids. Then the math began to shift. Fertility rates fell. Life expectancy rose. People left the workforce earlier, often with pensions that encouraged earlier exits. Instead of 5 or more workers supporting a single retiree, the ratio headed toward 3, then below. The same pay-as-you-go structure now required each worker to carry more of the load. There wasn't a catastrophe, just a slow demographic turn that made yesterday's promises heavier on today's shoulders. To smooth the bumps, Congress added the trust fund. Payroll taxes were raised above immediate needs to build a cushion. On paper, it looked like saving. In practice, the trust fund holds special treasury obligations, claims on future taxes or borrowing. During surplus years, the system effectively lent money to the rest of the government, collecting interest that would later be paid back by taxpayers. The optics, a lockbox. The reality, an IOU drawer. For a while, that worked. The surplus years masked the trend. Benefit formulas grew more generous, and cost of living adjustments indexed payments to inflation. The baby boom generation, massive in size, moved steadily closer to retirement. Meanwhile, the workforce changed. More service jobs, more gig work with irregular contributions, and periodic recessions that cut payroll tax inflows right when expenses climbed. The promise stayed the same, the base funding it thinned out. Every pay cycle, the bet continued. As long as enough workers pay in, retirees get paid. But the transition from surplus to shortfall was inevitable. Once the system needs to redeem the trust fund securities to keep paying full benefits, the Treasury must find cash by taxing more, cutting elsewhere, or borrowing more. The interest the trust fund earns doesn't come from a pile of invested assets. It comes from the same national wallet, yours, your employers, and future taxpayers. Here's why that matters emotionally, not just numerically. When you hear you earn these benefits, it sounds like your money is compounding in your name. It isn't. You paid for someone else's benefits, and future workers are expected to pay for yours. That's a social contract, not a personal account. Social contracts can hold, but they rely on ratios: enough workers, enough wages, enough compliance. When any one of those weakens, tension spreads. Higher taxes, later retirements, or quieter cuts through inflation. Meanwhile, the promise expanded beyond Social Security. Medicare grew, with parts funded by payroll taxes and parts by general revenue. Health costs rose faster than wages. The retiree benefit set turned from a monthly check into a bundle of medical commitments with price tags that don't sit still. The old idea, I pay in, I get out, now depended on forces no individual controls: fertility, immigration, labor force participation, healthcare inflation, and political will. People felt the shift without seeing it. Employers froze corporate pensions. Public pensions leaned on optimistic return assumptions to keep contributions down. Families faced higher healthcare premiums while payroll taxes stayed high. Younger workers were told to save more on their own, 401ks, IRAs, while still paying into the transfer system. The implicit message: cover your elders and self-fund your future. What nobody knew at the time or at least didn't say aloud, was how quickly the drawdown years would arrive once boomers retired in waves. The trust fund was always a timing device, not true savings. It pushed the hard choices into the moment when benefits outpaced payroll inflows. That moment is here, and the clock on full benefits is visible. The day the securities are exhausted, by law, payments can only match incoming taxes. That's a cut. Not a default, but a haircut many won't expect until it shows up in their mailbox. This was the moment everything changed. The story stops being about a program and starts being about your paycheck. If more must be collected to keep promises, it comes from wages now. If less is paid out, it's your expected future. If we borrow the gap, inflation and interest costs feed back into your living expenses and your mortgage rate. The setup lie isn't malicious, it's structural. We called a transfer a savings plan. We taught generations to see deductions as deposits. The truth is simpler and harder. It's a bill due every pay period, priced by demographics and policy, and it's accelerating toward the people working today. The ratio that broke the math. While that structural truth is settling in, look at the one number that quietly dictates everything. How many workers stand behind each retiree's check? In the 1960s, it was more than 5. A big, humming factory floor could carry a modest set of grandparents. Today, we hover closer to around 3, drifting down. That slide isn't abstract. It's the difference between a light backpack and a loaded rucksack on every paycheck. 3 things pushed the ratio down. First, fertility fell. Families got smaller, delayed kids, or had none at all. That means fewer future workers entering the payroll stream. Second, people live longer. Good news for families, tough for pay-as-you-go math. Checks go out for more years. Third, labor force participation changed. More schooling years, more caregiving years, and more workers cycling in and out of jobs. When fewer people work steady W-2 jobs, the payroll river thins. Meanwhile, the boomer wave didn't retire all at once. It arrived like a tide, crest after crest. Each year, another slice crosses the threshold. The cohorts replacing them are smaller. Even when the economy is solid, the inflow can't match the outflow unless wage growth and participation spike together. Immigration helps, but it's volatile and political. If policy brings in workers, the ratio steadies. If it stalls or skews older, the ratio sinks. Here's where it gets practical. The payroll tax is a simple lever. If there are fewer hands, each hand pays more. That can happen directly, higher tax rates or lifting the cap, or indirectly, through employers who pass their portion into slower wage growth or higher prices. You feel it either way. 0.1% here, a percentage point there, stretched over your early compounding years, becomes a larger mortgage delay or a smaller down payment. Now add the modern work mix. Traditional W-2 jobs remit payroll taxes every pay period like clockwork. But the rise of gig and contract work complicates the inflow. Quarterly estimates get missed. Irregular income leads to underwithholding. Compliance gaps widen. The system was built for steady paychecks. The labor market shifted toward volatility. Even with honest intentions, the timing of contributions becomes lumpier, just as benefit obligations become smoother and heavier. From their perspective, retirees aren't gaming anything. They played by the rules presented to them, paid in, and planned around a promise stream. From your perspective, you're covering people you love and millions you'll never meet through a formula that doesn't flex with your rent or your childcare bill. That tension isn't moral, it's arithmetic. Fewer workers per retiree means more dollars per worker unless benefits shrink. Let's walk into a kitchen in Milwaukee. A 27-year-old assistant manager, $58,000 a year, just moved into a one-bedroom. She didn't know her grandfather worked construction in the 70s. She never met her grandmother on her dad's side. But her pay stub carries them both, and millions like them. After FICA, after Medicare, after premiums, she transfers $300 to savings and wonders if that's irresponsible or brave. She keeps hearing the system might cut benefits by a quarter in about a decade. She's paying for the promise and pricing in a haircut on the promise to her. What nobody knew at the time, when the ratio first dipped under 4-to-1, was how hard the burden would feel once housing and healthcare ate bigger slices of take-home pay. In the 60s, the average worker's support for a retiree was distributed across a broad base. Today, the base is thinner and the non-negotiable expenses are thicker. The same percentage takes a bigger bite out of the life people are trying to build. Meanwhile, something else is happening. Participation among prime-age men never fully recovered to mid-century levels, and participation among prime-age women, after remarkable gains, flattened under the weight of childcare costs and fragile schedules. Each 0.1% missing from the workforce edges the ratio lower. We don't see it on the evening news. We feel it on the second page of a pay stub. This was the moment everything changed. Past a certain ratio, tweaks don't bridge the gap. The system either takes more from each worker or pays less to each retiree. There aren't many levers. Immigration policy can tilt the math if it welcomes more young workers. Productivity growth can help if it pushes wages higher across the taxable base. But those are slow levers, and the retiree wave is immediate and steady. In the aftermath, politics wraps the ratio in messages about fairness and earned rights. That matters, but the check still clears only if money arrives from somewhere. When you hear debates about lifting the wage cap or adding a new payroll tier, translate it into ratio speak. If the headcount can't rise enough, the dollars per head must. If resistance to higher taxes holds, benefit formulas will shift. Either way, the ratio calls the tune. And that leads to the next question you're already asking. If the ratio is this tight, what about the cushion everyone talks about, the trust fund? What's in it? How does it pay? And who ultimately supplies the cash when it's redeemed? The answer is more uncomfortable than the marketing suggested. The trust fund is IOUs, not cash. If the ratio is tightening, what about that cushion everyone keeps pointing to? The trust fund. Here's the plain version. Social Security's trust fund doesn't hold cash in a vault or a portfolio of private assets. It holds special issue Treasury securities created for this purpose. They're promises from one arm of the government to another. They earn interest on paper, but when the time comes to pay benefits, the only way to turn those promises into dollars is for the Treasury to raise taxes, cut other spending, or borrow from the public. What nobody knew at the time, when lockbox became a slogan, was how that language would camouflage the mechanics. In surplus years, payroll taxes exceeded benefits. Social Security used the extra to acquire those special treasuries. The rest of the government used the cash to fund other priorities. When benefits outstrip payroll taxes, Social Security redeems the securities. The Treasury then has to produce money by collecting more, spending less elsewhere, or issuing new debt. The trust fund is real as an accounting claim. It isn't a stash insulated from the broader budget. Now remember, interest accrues on these securities. That looks like growth. But that interest is paid by the same Treasury, which means it's funded by current taxpayers or new borrowing. It's circular. You can't escape the national wallet. Think of it like writing yourself a note and then celebrating that you're richer. The note matters legally. It doesn't add a second wallet to the kitchen counter. As the boomer retirements ramped up, the trust fund shifted from accumulation to drawdown. That's the phase we're entering. While it holds, full scheduled benefits can still be paid because redemptions fill the gap between payroll inflows and promised outflows. But there's a date on the calendar when the last of those special treasuries will be redeemed. The exact year moves with the economy, but the window, roughly in the early to mid-2030s, keeps coming into focus. Past that point, by law, benefits can only match incoming payroll taxes. That's the automatic cut. No congressional vote required. Meanwhile, this accounting setup creates a strange political theater. On paper, trustees can say the system is solvent so long as the trust fund balance remains. In practice, every redemption forces choices elsewhere in the budget. When the Treasury covers those redemptions, it may crowd out other spending or push borrowing higher. You won't see that on your pay stub, but you'll feel it in broader fiscal pressure, tax debates, interest costs, inflation risk if deficits meet a loose monetary stance. Here's where it becomes personal. When you hear that interest on the trust fund protects benefits, ask who pays that interest. It's you, your employer, and future taxpayers in some mix. When you hear that redeeming securities is routine, and it is, translated, routine means the Treasury must show up with cash on demand. In good times, that's manageable. In recessions, payroll taxes dip just as redemptions need to rise. The buffer helps, but it can't erase the cycle. Let's drop into a micro-story. A small business owner in Phoenix sees a headline, "Trust fund interest credited at billions this year." He wonders if that lowers his payroll tax bill. It doesn't. He still splits the 12.4% Social Security tax with his employees if they're W-2. If they're on 1099, they shoulder both halves. When benefits exceed inflows, redemptions tick up, and the Treasury's search for cash continues. His world doesn't change because a ledger entry accrued interest. It changes when Congress adjusts. Rates, caps, or formulas, or when deficits influence borrowing costs that hit his credit line. There's another wrinkle. The trust fund can't invest in equities or private assets by statute. That restriction avoids political meddling in markets, but it also means the fund never captured equity risk premiums that long-term savers rely on. It grew by collecting surpluses and interest from treasuries only. That choice kept it safe, yet tethered it to the same taxpayer base that ultimately funds everything else. Critics call the trust fund a fiction. That's too strong. It's a legal claim with real priority. The Social Security Administration can present its securities and receive payment. The fiction is thinking that payment doesn't affect you. Every dollar redeemed is a dollar the Treasury must source. If it borrows, debt rises. If it taxes, take-home pay shrinks. If it cuts elsewhere, other services give way. The trust fund spreads timing over decades. It doesn't eliminate the bill. In the aftermath of each trustee report, watch the language. Solvent until X buys political time. Depletion sounds like a cliff, but it's a formula snapback. Benefits align with payroll receipts if nothing changes. Something always changes. Deals arrive late, rate tweaks phase in quietly, caps lift, retirement ages edge up. The trust fund's existence gives lawmakers cover to delay hard votes. The delay shifts more of the fix onto younger cohorts because phase-ins hit future earners. So when someone says, "Don't worry, there's a trust fund," ask a simpler question. Who brings the cash when those bonds mature? The answer loops back to you and your peers. That's why pensions with real assets feel different. They may be underfunded, but at least they hold market securities that can be sold. Public systems often assume high returns that may not materialize, creating their own gaps. Which brings us to a harder truth. If the Social Security cushion is an IOU to taxpayers, and many pensions are stretched, the safety nets stack, and the strain compounds. We leave the ledger and walk into promises that live on the same balance sheet. Pension promises underwater. While the trust fund leans on taxpayers, another layer of promises is slipping below the surface. Pensions. They were supposed to be the solid ground. Checks backed by decades of contributions and careful investing. But the ground has shifted. Public funds often assume returns around 7% to keep required contributions politically palatable. Markets don't move on municipal schedules. When reality undershoots those assumptions, the gap doesn't vanish. It compounds. Here's the quiet mechanism. A pension's liability, the promise to pay retirees for life, is discounted back to today using an assumed rate of return. Raise the assumption, and the liability shrinks on paper. Lower it, and the promised mountain looks taller. Many plans keep the assumption high, sometimes justified by long horizons, sometimes to avoid asking cities and states for more cash now. Smoothing rules spread losses over years. It takes the sting out of bad markets, but can hide the wound until it's deep. Corporate America saw this coming and moved. Many big companies froze defined benefit plans in the 200s and 201s, shifting workers to 401ks. That doesn't erase promises already earned. It stops new accruals from adding weight. The Pension Benefit Guaranty Corporation stands behind private plans that fail, but its coverage has limits. If a plan collapses, benefits can be cut to PBGC caps. That's a safety net with a height limit, not a parachute that fits everyone. Public pensions are a different story. Teachers, firefighters, city workers, millions rely on state and local systems. These funds can't be backstopped by PBGC. They rely on contributions from governments and investment returns. When markets lag or costs rise, elected officials face two choices: raise contributions, meaning higher taxes or service cuts, or tilt assumptions to keep budgets stable. Many try a bit of both, buying time while the gap quietly grows. Walk into a city council budget meeting in late spring. Pension contributions come up. The finance director proposes an increase to keep the plan on track. Someone asks what gets cut. Library hours? Road resurfacing? The room cools. A compromise follows. A smaller increase and a promise to revisit next year, plus a decision to keep the return assumption steady. On paper, funding looks acceptable. In real terms, the plan still leans on tomorrow. There are case studies everywhere. States wrestle with billions in unfunded liabilities. Some raise employee contribution rates. Some reduce cost of living adjustments, COLAs, for retirees, not always legally simple. Others stretch out amortization schedules, lowering the annual bill but lengthening the mortgage on the promise. Each tactic delays pain. Each shifts more risk onto younger taxpayers who didn't make the original promises but will finance the repair. Discount rates aren't the only lever. Asset mixes have crept into riskier territory. To hit return targets, funds add private equity, real estate, hedge funds, assets with opaque pricing and long lockups. They can deliver, but they also blur transparency. In a downturn, stable valuations can lag reality, smoothing losses just when decisions should sharpen. The reported funded status looks better than the economic one. Meanwhile, benefit checks still go out every month. When a plan falls short, who pays? Residents, through higher taxes and fees. Workers, through increased contributions that cut take-home pay. Retirees, through COLA trims or new formulas on future accruals. Or everyone, through service cuts that reduce the value of living in the community. Sometimes it's all of the above. The payroll you saw in Social Security repeats at the local level. The bill chases whoever has cash flow. Listen to a public school teacher at 59. She's been promised a defined benefit, calculates her years, and plans to help her daughter with childcare when she retires. Then the district announces a COLA change to stabilize the plan. It's a few percentage points she won't see each year. That sounds small. Over a decade, it erodes the cushion she counted on. She'll keep working part-time. Her daughter will rethink daycare. A formula adjustment ripples through a family. From a small business owner's perspective, the pension story shows up as a property tax hike, a new municipal fee, or slower permits because the city trimmed staff. He isn't in the plan. He's funding it anyway. Add Social Security and Medicare payroll taxes, and the combined load decides whether he hires a second employee this year or waits. The pension gap becomes a hiring gap. Here's the connective tissue to Social Security. Both systems depend on return assumptions, explicitly for pensions, implicitly for payroll growth. Both use smoothing to manage optics. Both push tough choices into the future. And both, when reality intrudes, harvest from the same field, current workers and current taxpayers. Stack them, and the burden grows heavier where paychecks are still developing. The hard part isn't villainy, it's math plus time. Promises were made honestly. Life got longer. Markets zigzagged. Budgets tightened. The way out is straightforward and painful. More contributed sooner, more realistic assumptions, and guardrails on benefits that prevent runaway costs. The longer we wait, the fewer gentle options remain. And even if we make perfect decisions for pensions, a larger force is bearing down. It's the program that turns routine illnesses into fiscal avalanches. Medicare steps into frame. The Medicare elephant in the room. While pensions wobble and Social Security leans on IOUs, Medicare quietly eats the biggest slice of the pie. It has multiple parts with different funding streams, and each one pulls from a different pocket you live out of. Part A, hospital insurance, is financed by a payroll tax like Social Security. Parts B and D, physician services and prescription drugs, draw mostly from general revenue with premiums layered on top. Translation: even if your paycheck isn't directly tagged Medicare, the program still reaches you through taxes, premiums, and the price level of everything else government buys or borrows for. Start with Part A. It has a trust fund too, the HI Trust Fund, fed by that 1.45% payroll tax from you and 1.45% from your employer, with an extra 0.9% for high earners. When hospital costs outpace those inflows, the trust fund shrinks. Trustees have circled a depletion window in the early 2030s more than once, extending or compressing it as the economy and spending shift. When it depletes, the law doesn't shut hospitals. It forces payments to match revenues, which means automatic reductions to providers unless Congress intervenes. Cuts to providers ripple into access, wait times, and which services survive in thin-margin hospitals. Now look at Parts B and D. They don't go broke because they're not funded by a fixed payroll stream. They reset every year. About a quarter of their cost is paid by beneficiary premiums. The rest comes from general revenue. When healthcare costs accelerate, and they have for decades, the required general revenue grows. That money doesn't fall from the sky. It competes with everything else: defense, education, infrastructure, and interest on the debt. If deficits fill the gap, interest costs mount. If taxes rise, take-home pay falls. That's the crowd out people feel without seeing the Medicare logo on their pay stub. Healthcare costs don't move like groceries. They rise faster than GDP, more often than not, driven by technology, utilization, and prices insulated from normal market pressure. Aging adds a volume effect. More people hitting the age where they use more care. An 82-year-old has a different pattern of hospital days, scans, and prescriptions than a 42-year-old. When a large cohort crosses into Medicare, the utilization curve rises across the board. You can't fight that with slogans. It's biology scaled by policy. To manage the bill, Medicare has leaned on means testing. Higher-income retirees pay larger premiums for Parts B and D through IRMA surcharges. That sounds targeted, but the thresholds can drag more people in over time if they don't rise as fast as incomes. Younger workers also pay indirectly. General revenue comes from broader taxes. If bracket thresholds don't keep pace with inflation and wage growth, more middle earners drift into higher effective tax rates. That's another quiet reach into the wallet to fund care delivered to someone else today. And to yourself someday, if you ever get there. Here's a living room in Columbus. A 63-year-old self-employed contractor stares at his marketplace premium and counts months to Medicare. His 28-year-old daughter, a nurse, is paying down loans and paying her share of payroll taxes.